I was actually born in Acres Homes, reared here for most of my life. I stay because I know my patients need an advocate that understands their socioeconomic status.
Because of Lily, we are able to educate Black Americans about how best to take care of their breast health.
Black Health Matters brought a mobile mammogram unit here. You didn't have to have insurance, you didn't have to have money. All you had to do was raise your hand to say, I need a mammogram.
The importance of bringing the mammogram to Acres Homes helps address the actual need, and that's access to health care. African American women, when we do present with breast cancer, we're 41% more likely to die from it, and it's a more aggressive form.
I went and had a mammogram. This is the first one I've had since COVID began, and they were very knowledgeable as to what they were doing. It was very easy.
Today, I had a couple of women tell me they hadn't had a mammogram in 5 years or 10 years. And that's why we like to partner with Social Justice Solutions and For the Breast of Us, because they're also handing out materials about breast health.
For the Breast of Us is working to educate and ensure that women know their risk factors, that they're encouraged to get their mammograms, and that they know how to do their self-breast exams and understand the signs and symptoms. Because the earlier you can get in and get checked, the better your outcomes are.
I grew up here. My church is right up the street. My mother still lives here. Everything about this community is me. I was diagnosed at the age of 34. And I thought when I was done with my treatment, okay, I'm done, I'm good. The problem that I ended up running into was when I lost my job, losing my health insurance. My husband was laid off from his job, so that meant losing his health insurance. The only way that a breast cancer survivor can maintain optimal health is by having those annual mammograms. And I couldn't get one for 3 years. My anxiety was like, I think I feel a lump. Do I feel a lump? I just didn't know. And so finally I decided, I said, okay, I'm gonna have to just bite the bullet and go to one of the local resources to get a mammogram done. And that didn't go well either. I had to provide my income tax returns. I had to tell them how I was paying my bills. I was receiving food stamp benefits. I was broke. And they still told me I had to pay $150. My husband passed away in April of 2020, and he was a veteran. So it's unfortunate, but he had to die so I can live. That's the only way I was able to get health insurance. The fact that free mammograms are being offered here today means so much to me. People see cancer as the bald head or the pink shirts and the pink tutus, but it's more than just that. It's a long-term effect being a survivor. It's not just the initial diagnosis and you get your chemo and your radiation and you're done. No, I'm 50 years old, I'm a 15-year survivor, and I'm still fighting.